Thank you, 29. Fire an ambulance en route. ETA 3 minutes. Thank you, 29. Fire an ambulance en route. ETA 3 minutes.
Okay, well, good morning and welcome to day 3 of the Datamark Virtual Public Safety Conference. I'm Jason Bivens, Director of Business Development for the Datamark team. Just to recap a little bit about day 2 of the conference, there were actually over 1,030 participants across the 6 sessions yesterday, which means there was an average of 172 of you at any given session, which is awesome. With the highest attended event being self-care for dispatchers dealing with crisis with 202 of you. That was given by Adam Tim from the Healthy Dispatcher. We watched a range of topics, including the power of storytelling by Ricardo Martinez from Within the Trenches, dashboards during Corona from Esri, assisting rural communities build GIS capacity from Geodata Services, and public safety, the new first response frontier, which was given by our own Sarah Rollins. We'd like to thank our conference sponsors. They're so important to us, and they've really helped us spin this up, and they provide a lot of this really awesome content, which you'll start seeing here in just a couple minutes, including, and those are Esri from yesterday, Within the Trenches, the Healthy Dispatcher, Geodata Services, and our governmental partners that provided great insight and panels in our panels and presentations. Today we have a lot of content in store for you, starting with our keynote address on 911 leadership in times of crisis, followed by Don't Get Mad, Get Even. Other topics include an update from ERISA on their efforts in NG911, an NG911 grassroots movement in Mississippi, a panel discussion on collaboration for NG911 from the state perspective, hosting lots of state officials, GIOs or Geographic Information Officers, and 911 program managers, discussion on call taker and dispatch reliability, and then closing the day with a discussion about options and functions contained within an NG911 logging recorder. We're hearing a lot of conversation about moving 911 centers into a virtual environment, and I think that's a great topic for today and us to cover in general. Before we begin, I'd like to let everyone know that this webinar is being recorded, and for quality assurance purposes, all attendees have been muted. If you have a question, please use the Q&A button, which is located at the bottom of your screen. You just click on it, and you can ask questions of Chris. We're going to take those questions at the end of the session, so feel free to just send the question whenever you have it, and we'll answer those at the end. So without further ado, I'd like to introduce our keynote speaker for today, Mr. Christopher Carver, is Hexagon's Director of Sales for the Eastern United States and a 25-year veteran of the public safety, communications, and 911 industry. Today, he'll be speaking about leadership in times of crisis. Welcome, Chris, and thanks for being with us today. Take it over.
All right, good morning, Jason. Thank you, and thanks to Datamark for taking the lead in creating an event that I think is incredibly necessary, and an example really of many of the concepts that I'll share and talk about today. So what the keynote presentation is going to be is basically talking about how to lead in crisis, how to organize yourself and your organization and what your operations are, and really how you approach this really unprecedented time. That really needs to start, though, with an acknowledgement that these are challenging times for everyone. No matter who you are in this country today, we're dealing with something largely we haven't faced before. That kind of goes without saying, but it's something we all need to be reminded of, because the skill sets that we're going to talk about today, I'm going to offer you sort of an 11-step process, if you will. That process isn't necessarily new, but it is new in what we're applying it to. But before any of that, I just want to say thank you. As Jason mentioned, I've been in public safety for 25 years. It's been the greatest joy and honor of my life to get to know probably more than a few of you who are attending today. And I hope to get to meet and know many of you that I haven't met already in the coming years. And over that time, I have been consistently, massively impressed with the work that every single person I have met has done. Every single day, in this country, every one of you faced challenges and accomplished things that others probably thought were impossible. And that is where we need to begin, by first thanking you for what it is you and your coworkers and your fellow professionals in public safety, really thank you for what you do. Just getting up out of bed every day and going and dealing with the activities and the events that we all face, that's important. And you've already answered the question that you see on this slide. What good shall you do this day? Well, many times it's just by going to work. It's by committing yourselves to being part of what is the 911 and public safety profession. So congratulations and thank you to all of you who have made that commitment. And especially thank you and congratulations to those of you who are making that commitment during this particular time. And know that what you've already proven you can do, well, that's the foundation of what we're going to talk about today. So, what are those keys to successfully surviving these crazy times? What are the keys to getting through this? And why in the world do I get to sit here and talk about it today? Well, I don't get to sit here and talk about it because I'll put myself up as an expert or anything like that. My role here today is simply to share some of the experiences that I have had personally, but also to share what I have been able to work through myself, to share what I have been fortunate or challenged to go through during the time that I've been involved in the public safety community. If you saw the introduction slide, or if you know me already, you know that my own personal 911 journey has taken me from being a dispatcher in a single seat fire and EMS operation in Central Ohio while attending The Ohio State University, all the way up to being the director of FDNY's fire dispatch operation. Along the way, along those years, it's safe to say that I worked for more than a few crazy days, that I got to experience a few times when I went to work that I didn't know what was going to happen, and my coworkers didn't know either, and that really nobody in our community did, because we were operating in a space that we had never really planned for. Probably the best example of that, or the one that many know, obviously a lot of people will know, is 9/11. But there's a variety of other events like that too. And the reality is that every single one of you listening to this presentation and watching it today and attending this conference and working in some professional capacity through the COVID outbreak that we're experiencing in this country, the reality is that every one of you have a day in your history as a professional in public safety where you woke up, you maybe stopped at Starbucks or Tim Hortons or Dunkin' Donuts or whatever variety of coffee shop that you happen to love. You stopped there on your way to work, whether it was for a day shift, an afternoon, a night shift, or a 24. You grabbed your coffee or whatever your drink of choice is, your mocha latte, and then you went into work and you thought, oh, this is going to be an okay day. And then at some point, a little ways in, maybe shortly after you arrived, maybe a couple hours later, but at some point, all hell broke loose. And at some point during that shift, whether it was a fire, whether it was a flood, God forbid, maybe it was a mass shooting, maybe it was an officer-involved shooting or event, or large-scale disaster, or a train accident, or a plane crash, or whatever it is, every one of you have already had that day where it all of a sudden went off the rails. And fortunately, every one of you are here to talk about it today. And even more importantly, are here to look back and say, hey, what did we do then? What did we do to get through that day as a group to get us to where we are now? That's really the core of what we're going to talk about today. I don't believe that I have any magical insight to offer. I don't believe that anyone does, quite frankly, except maybe some of the medical professionals who specifically have knowledge about this outbreak and what, the components of that are unique to a pandemic. But the reality is that getting through in an operational context, in a day-to-day context inside a 911 center or a police station or a fire station or a hospital, we sort of have that at least partly already. And what I want to do today as we go through and talk about some of these specific keys is basically to remind and build on what we've already talked about. So the very first thing that we need to talk about to remind ourselves in terms of what we need to do, that would be health. We need to talk about our ability to move forward and become better and healthier in terms of our emotional and physical health. And I'm going to have to ask Jason and our reminders here to give me back control of the slide deck. I don't have the ability to move the slides at this point. But the reality is that what we need to make sure we accomplish first is to ensure that we're okay. So, of course, in terms of a pandemic that has specific actions associated with it, we have specific tasks that we're required to do. You know, we've all talked about hand washing and things like that. That's really, really, really important. But the additional steps that we need to do that are even more important are making sure that, we're going to try to get this slide deck running again here for you. We need to make sure that we can take care of ourselves emotionally. We need to make sure that we can take care of ourselves physically. We need to make sure that we can take care of ourselves as a community. So let's see what we can do here and get this to go forward. I don't know why. There it goes. All right. So we need to make sure that we are able to focus on our health. And I apologize to my coworker and friend Jess Innowald for sharing her. I didn't give her a heads up that that was going to happen. If she's on today, Jess, I apologize. But what does health mean? Health means, like I said, in terms of following the precautions that we've been advised to do, that's really, really important. But it's also really important to make sure that we take care of ourselves emotionally now too. So if you have a support network, if you have a support process that you can do, that this is going to be the time to do that. And make sure that you're following up with it. I would almost go to the point of creating a checklist for yourself each day. Are you going to make sure that you have time with your family? You reach out to those that maybe you're not able to be in physical connection with because of the regulations and rules around how we have to respond to this virus. That is really an important step to take. Make sure that you are building that both physical health and emotional health throughout this process, because that's going to make it easier for you to be able to do the amazing things that you have to do each day in your professional capacity. Next up, we need to make sure that even in these times of physical distancing, that we're practicing community. And inside the 911 world, inside the public safety world, practicing community is absolutely essential. Now, what do I mean by community? That particular slide shows you one example that in more socially acceptable times to be outgoing and doing things, diners are, of course, one of my personal favorite ways to engage in the community. But inside the community that is public safety, now more than ever, in the face of what's going on, we need to leverage those that we can connect with, now, of course, virtually or through email or through online forums, and do the exact kind of things that we're all doing today by attending this particular virtual conference. As this pandemic is affecting different communities in different ways, that means we have an even greater opportunity to learn from others. One of my personal pet peeves in the public safety world is that so often we end up having to relearn lessons others learned a week ago or a year ago or 10 years ago. Please leverage the opportunities available, whether it's through professional organizations like NINA or APCO, whether it's through your vendor community if they have professional associations or user groups that you can be a part of, whether it's through law enforcement or fire or EMS networks, wherever they are in this moment in time, remember, you are not going through this alone. No one is. And that means that we can learn from what others are experiencing and leverage those lessons for what it is that we ourselves are going through in our communities. So I encourage you, please make sure that you are taking advantage of that so that we can get the best results for our organization and for those that we serve, whether we're talking about serving the community, our field responders, or both. Being a part of a community today means having those resources available to us. Next up, please make sure, and I say this with a little bit of caution, faith. What I mean by faith in this context is not to advocate any one particular faith practice. But if you have one, whatever it is you believe in, whatever it is you believe is your higher purpose for serving the community, I encourage you to be in touch with that during this time. That has been, I think, for as long as there have been folks in public safety, a frequent and recurrent bedrock of what gets us going forward. And your faith may just be believing that you are in a position to serve all those around you and your family and your friends and your community, and that may be enough. Maybe your faith is a particular religious practice. Whatever it happens to be, I encourage you to find ways to remind yourself of it during this time and to reconnect with it whenever you have the opportunity to do so. This next one, number 4 in our list of ways to get through this particular event and skills to practice, this is terribly important, and that's patience. Every single person around you, every single day, is struggling with how to get through our normal daily challenges. How do we balance the schedule and the demands of the children that we have that are going to school, that have to go to practice, versus the demands we have to do our jobs and do the things there that we need to do, versus our obligations to perhaps parents who we care for and who we have to help out, and a variety of other things. When you add on normal daily stress to that, it gets hard. When we're in public safety, it's even harder. When we're in public safety during a time like this, for many, I can imagine it almost seems impossible. I encourage you to practice patience with those you work with the responders in the field, with those on the other end of the phone, and with yourself. This is going to require a long duration practice of patience and tolerance and acceptance with those that we work with, those we serve, and those with whom we interact. And just by making a little bit of an effort, you'll make it easier for those you work with, those you live with, and those you serve to get through it. Next up, along the same line, every single person in this world today dealing with this could use a little more kindness, especially those dealing with this from a professional perspective. There are so many ways that we, and I'll be honest, I've been in the center, I've been in this business a long time, and I'm telling not any really hard and fast secret when it comes to 911. Sometimes we're not the nicest to our coworkers. Sometimes we're downright mean, and that especially finds its way to how we deal with some of our new hires and some of our younger members of the community. This is a time, if any, to step back and think about treating others the way we'd like to be treated. Taking the time out to share the insight and knowledge we have with our coworkers, especially those that maybe haven't come in, that have come into the job recently. This is the time to be a little kinder to that field responder that probably didn't read their remarks on their MDT. You know it, I know it, we all know it. They don't necessarily need to be reminded of it. This is also a time to be a little kinder if you are in a management or leadership role. I beg you, this is not a time to crack a whip. This is a time to pat somebody on the shoulder and say thank you for everything you're doing, and do everything we can to help everyone lift up their spirits to get through this. The sad part of what we're going through is that we're not, as a nation, probably at the peak yet. If you're following the guidance from CDC and others, we have not only a long way to go, but a long way to go in which challenges are only likely to increase. Never underestimate the power of kindness in a situation like that to make things better. Next, I encourage all of you to think about ways that your agency and we as a profession can work through this event, perhaps in ways that we've never anticipated before. Being creative about solving problems, meeting challenges, having conversations with others that maybe you never had before, this is the time to start doing those things. I remember one particular night during Superstorm Sandy when it impacted New York, when a radio transmission from an engine company desperate for waterborne resources to help rescue people trapped on flooded streets indicated that they had figured out the best place to get boats from was the boathouse at a New York City park. And they did not ask for permission. They asked for forgiveness as they acquired boats from literally the park building, threw them in the back of a fire apparatus, and utilized those resources to rescue people that otherwise might not have been saved. Because they were able to think outside the box, because they were able to identify resources that otherwise we didn't even really know existed, we were able to do some really great things as a team and effect rescues. That's the kind of thinking that we need to bring to bear to solve the challenges that are likely to come as a result of the increasing impacts of COVID on our 911 centers and on our field responders. Next up, again, be creative. There is no dusty binder on the shelf inside a 911 center for a pandemic, or at least not any one that I've ever seen. But that doesn't mean we haven't dealt with really crazy events before. That doesn't mean we haven't had, God forbid, a mass casualty incident or a plane crash or something and had to figure out how to acquire a whole bunch of ambulances in short order. It doesn't mean that we haven't figured out how to operate 911 centers, perhaps from locations where we never planned for it before. Many of you are dealing with that today as you think about what happens if you have to shut down your building. Where is your backup center? Think outside the box. I had the privilege of hearing an idea from Nancy Lockhart from South Bend, Indiana the other day about utilizing 911 center backup facilities in hotels. So they have conference rooms, they're connected to networks, they have accommodations, why not? And those are the kinds of ideas, and that's just one example of a million, where hopefully with all the brain power that we have working in our centers today, we can come together to identify unique solutions for the challenges that we're all about to face. And next up, and this goes without saying, but perhaps we need a reminder, that times like this are really when the humor is important. Now, I'm not saying do anything too crazy or anything destructive. Dear God, no, definitely not that. But these are also times where we're going to have to fall back on some of the greatest attributes of working in public safety. And one of those things is humor. That's what helps us get through even the normal crazy days, much less the craziest of crazy days. So for those of you that have a sense of humor and want to make a joke about some things, I encourage you to do that. Of course, not to the point that it offends anybody or degrades from your ability to operate as a team. But serious times call for us to actually be able to have some humility and have some humor in the course of our operation. It'll help make everything better for everybody and help us get through this particular crazy time. And next up, I encourage you to think about resilience. There are a variety of tools that are available online, in print, and in training classes to figure out what your particular path to resilience is. I'm going to speak to the supervisors right now, those that are frontline leaders inside their organizations, whether you're in 911, police, fire, EMS. You are the ones that know your people best. This is your time to leverage that knowledge to ensure that your organization is effectively operating day to day. You'll need to be the one to know how to overcome the really challenging events that we're facing from the viewpoint of your people, those whom you serve. I encourage you, I beg you to reach out and find the resources that are available to help your personnel succeed, not just in terms of the operational impacts. How do I find 50 ambulances on short notice? But in terms of the emotional health impacts, please become the advocate for your personnel so that they can find their way through this long-term event. That is one of the most important things that you can do, and I encourage you to leverage all available resources to make it happen. Along that same line, recognize no matter what your role inside 911 or public safety, that you are now part of an enormous team of professionals tasked with getting this country through something it has never experienced. That obligation, that responsibility is now shared by all of us, whether we're a vendor, whether we put on a headset every day, whether we drive a police car, an ambulance, or ride the back of a fire engine. We are all part of a team. And what does it mean to be a part of a team? Well, it means you know what winning means. We've all agreed that we know that getting through this successfully and minimizing the impacts on our community, that's really, I think, what winning means. And if we all know what winning means, then we can identify what we have to do to help our team win. That means during this time, being the best possible team member that you can. Go the extra mile to provide the best customer service on a call. If you pick up clues that something is worse maybe than perhaps the protocol indicates it is, or perhaps you're a field responder and pull up on a scene and you're thinking, wow, something doesn't quite look right. Now are the times when those intuition-based skills are so incredibly important. If you know something now and you're inside an organization that's tasked with providing public safety, now's the time to really share it. Now's the time to share the knowledge that you have. For those of you that have been in this business for 10, 15, 20, 25 years or more, now is your time to share not only your knowledge, but your experience and awareness that we can all get through tough times. That's really the strength you bring today. Not only that, but also the fact that you may be the best person to know where the threats are in a community, where the actual challenges are going to be. Just like when a really bad flood happens, you might be the one to know that a certain road washes out pretty early on in a flooding situation, or you might know that a particular building is an extreme threat if a fire should occur there. That's all being part of a team, sharing your knowledge and also sharing your ability with all those around you. So I challenge every one of us to be the best possible team member during this likely worst possible time. And what do all those things mean together? All those things mean together that now is a time where we have to practice trust and we have to demonstrate it. If we bring our best selves into our environments where we work, in our communities, if we bring our best knowledge, if we make sure that we're the best possible team member, if we make sure that we're able to solve problems creatively, we're able to think outside the box, we entertain and encourage new ideas about how to address what's going on today. If we do all those things, then we create a culture of trust. When I first started as a fire alarm dispatcher in the New York City Fire Department, I was responsible, as were all new hires, for making coffee, even though, believe it or not, back then I didn't drink it. And I thought after a couple of weeks or months of having to make this coffee all the time that I didn't even drink, hey, what kind of BS is that? I have to make coffee that I don't even drink? It took me a little time to realize why they tasked the new hires with making the coffee. They did that because if you as a new public safety professional, as a fire alarm dispatcher in the FDNY, if you couldn't be trusted to take ownership of making coffee every couple hours and ensuring that you cleaned up the coffee pot and made sure the coffee supplies were there, well, if you couldn't take ownership of that responsibility, then how could they trust you with what your responsibilities were in the process of being an FDNY fire alarm dispatcher? In other words, if you can't trust someone with the basics, how can you trust them with the really big stuff? So I encourage you to find the ways to trust those you work with, to build up your abilities as a team, and to leverage the things that we've talked about today to get better results for your communities and your organizations. Because the best possible resource, the best possible way through this is for you to be the best possible member of the team that we're all now a part of. You, the individual listening to this, your role in public safety, you are the greatest resource we have. So I encourage you, please stay healthy, stay safe, and be the best example that you can possibly be for your organizations. Thank you very much. And with one final quote from Winston Churchill, who said it best, if you're going through hell, please keep going. I think that applies to all of us. So thank you again for being here. Stay safe, and I look forward to seeing you all very soon.
Hey, Chris, thank you so much for such a great presentation. You know, one thing that you said that really hits home for me is the idea of putting people first. If we put our people first from a leadership perspective, they're going to put their people first, which is the callers and the citizens that they're serving and their colleagues. So thank you so much for a great presentation, and look forward to hearing more from you. Have a great day.
Thank you, Jason.